Good morning, dear friends. Starting with our series on heart diseases and what causes them.
Manipal Hospital
Cardiac Care Center presents to you series lecture 1. So, as I mentioned to you last time, this is your heart. It is supplied on the right side by right coronary artery, on left side by the left main, which divides into two, the left anterior descending, which goes in front and supplies the front of the heart, and circumflex, which goes around to supply the side of the heart. Now from inside, the artery looks like this. As you would be able to see, it has an outer lining which is tunica adventitia. This is the media in between, and this inner lining is the tunica intima. Now, a healthy vessel develops a fatty plaque or a fat deposition, and this slowly increases in size to narrow down the vessel size, and this is what results in symptoms of shortness of breath, chest pain, tiredness, or palpitations. Your patients would often feel that they would earlier be able to walk, but now they get very tired doing the same thing, or they get very breathless, or they get a chest pain which is in the center, possibly going to the neck or the back, or just a dyspepsia like feeling every time they exert. Sometimes this plaque may rupture, causing sudden blockage of the artery. This is heart attack. When this clot suddenly blocks the artery, it is called heart attack or acute myocardial infarction. It is at this time that the patient starts to get a chest pain, which may be in the center of the heart or radiating to the back, going to either of the arms, neck, or just in the lower part of the chest and upper abdomen, along with profuse sweating, tiredness, and breathlessness. This pain, when it is persistent or coming and going and not getting relieved, is often a pain of heart attack. So what should we do? In order to prevent yourself from sudden catastrophic event like death, you must report to your nearest hospital, preferably a hospital like ours which has a cardiac cath lab which functions 24/7 to open that block and relieve the obstruction. Now, why does this block come up? So there are 5 reasons of heart disease: diabetes, blood pressure, obesity or laziness, stress, and smoking. On top of this, if you have dyslipidemia, meaning cholesterol levels are high, heart disease comes in these individuals. Of course, with age, male sex, or a family history of heart disease are additional risk factors for heart disease. So what can we do to prevent? Okay. Again, there are 5 things: right food, right exercise, right medicines, right habits, and right thought. So for 5 things which produce heart disease, you have 5 things which are a break or which help you prevent the heart disease. So if you eat right, avoid sugars, avoid sweets, avoid things from outside, have healthy natural food including eggs, including milk, curd, paneer, some butter, desi ghee, and do your daily walking of half an hour to 45 minutes. Do not smoke, meditate for a while, take your meds daily. You can prevent yourself from heart attack. If, however, you have symptoms of shortness of breath, tiredness on exertion, palpitations or fast heartbeat on exertion, or breathlessness on exertion, you must show to your doctor, preferably a cardiologist, who can help solve your problem. Not all heart diseases need to be fixed with a stent. As a first step, your doctor would possibly do an ECG, which is an electrical tracing or electrical activity of your heart, an echocardiogram, which is like an ultrasound scan of your heart, a stress test like a TMT, unless he is very sure that you are having a cardiac problem, when he may advise to do a diagnostic procedure of coronary angiogram. Coronary angiogram uses a small amount of dye to visualize the coronary arteries real time and to assess if there is a tight block and how to fix it. Unless your block is more than 3/4 of your vessel, like this diagram where I showed you that after this plaque has pushed in and it has closed almost 80% of your artery, this is the blockage which may need to be opened up with a stent. Otherwise, at less than 3/4 of a blockage, if you are not having significant symptoms, your doctor may just treat you on medicines. So do not shy away from taking a consultation and meet your doctor who will help fix your problem. That's all from me. See you in the next talk. Thank you.